Welcome, friends, to another edition of More Bad News, brought to you, as always, by Camel Cigarettes. Take the Camels Challenge, smoke Camels for 30 days, and see for yourself what a difference Camels can make in your life. Well, my friends, some of you have been wondering about my sponsor. As you know, I don't monetize my videos. The only thing I'm selling is Camels. Now, in the early days, I had two sponsors, actually, Camel Cigarettes and Jack Daniel's Bourbon. But after a few seasons, I dropped the Jack Daniel's. Selling alcohol to college students was problematic. The show began as a way to present U.S. history survey so that alcohol and tobacco were the two crops that really made the colonies possible. The idea the United States would not exist without tobacco, it was the first successful import that made the colonies venture profitable. And I chose Camels actually because I really did smoke Camels, and I really do appreciate tobacco as something that people indulge in and enjoy. But tobacco goes back thousands of years before the first white man arrived. Tobacco was considered sacred across the continent. The tribes would all get together and they would share tobacco at their powwows. There was something about tobacco that people used in congregation to enhance communication, and I found this to be very true in my life. I remember that when I first got here at Ferris, that in the was 1988, 89. There was smoking on campus. You had a smoking lounge in the Star Building, and Clarence DeLong, who was down the hall from me. He was a smoker, and I would go down and sit down. He'd pull out a packet right away and offer me a cigarette, and we would sit, we would smoke, we would uh, get to know each other in a way that I never got to know Paul Spagnolo, who didn't smoke. These were the two senior faculty members, and so tobacco was the first thing that Europeans experienced when they met natives, and I used to imagine that. I always imagine that first toke that the Europeans must have had, and realizing that this was really something enjoyable and a product that they might be able to sell in Europe, and indeed it took off around the world. One of the things that I pointed out is that it's very seldom pointed out is that we can take pride and credit in bringing tobacco to the world. The tobacco is smoked everywhere in the world, and virtually we are really can be proud of ourselves for turning this sacred product into this deadly cancer-causing stick. Um, but tobacco smoking has always been a part of my life. I began smoking about 10 years old. I used to steal cigarettes from my mom and go out back and smoke in the chicken coop. So I should say that uh, uh, I was really spoiled as a child. I had a crazy cousin, Miriam, and she was my mom's cousin. And she was always encouraging me to do crazy ventures. So when I suggested that we might want to have some chickens, she thought that was a great idea. And we went out, and before you know it, we had a coop outside with chickens. This was in a suburbs where there were no other chickens around, and the neighbors didn't appreciate the chickens. I don't know what happened to the chickens, but I do know that it didn't last, and we never ended up collecting any eggs, so it didn't go very far. But it did provide me with a nice, cozy little place to sit with my chickens and smoke menthol cigarettes. I got to know them very well. Uh, Cigarettes and advertising grew hand in hand with modern advertising. And in the 1940s, tobacco companies hired doctors and dentists to endorse their product to reduce public concerns about smoking, about the risk of smoking, using smoking slogans like just what the doctor ordered or more doctors smoke Camels. The companies misled people, showing them physicians were also smokers and that cigarettes were fine for your health. Uh, this uh, idea of using propaganda to manipulate a population in order to forestall government regulation really took off and was used not just by the tobacco companies and not just by the oil companies, but by all kinds of corporations that were involved in manipulating people. There's a wonderful book written by uh, um, Orescus on this kind of manipulation. The name escapes me for the moment. I'll put it into in the notes at the end. So the tobacco company, tobacco is really, it's central to who we are, but it's also central to our demise, because it is this idea of that more doctors smoke Camels than oil is, it hasn't been proven that the global warming, climate change is happening, etc. These are all interwoven and interconnected things. Well, last week, Friday night, I went to the commencement ceremony for the pharmacy PhDs. It was, I have a wonderful student who's like a son to me, very close. He was a student of mine as a freshman, and now he's getting his PhD, and I went to commencement. I was the only person other than one other. There was an elderly Asian woman who was wearing a mask. I was the only other person wearing a mask, and it was just this was the pharmacy students. Now, according to the New York Times report of April 24th, roughly 100,000 Americans are still being infected by COVID every week, and 150 are dying from the infection every day. That adds up to 5,200,000 cases a year and 55,000 deaths. Dr. Robert Wachter, the chair of the Department of Medicine at the University of California in San Francisco, said that he continues to wear a mask when he's in crowded indoor settings. The WHO statement of January 30th, which is generally reported as the official ending of the pandemic worldwide, stated that COVID continues to constitute a public health emergency of international concern. PHEIC is what they abbreviated. The difference is that COVID is now endemic around the world, and so it's no longer a pandemic, because a pandemic means that it's spreading, and it's no longer spreading. It just is everywhere. While the world is this is a quote from the WHO report, which everyone touted as saying it's all over. While the world is in a better position than it was during the peak of the Omicron transmission 1 year ago, more than 170,000 COVID-19 related deaths have been reported globally within the last 8 weeks. In addition, surveillance and genetic sequencing have declined globally, making it far more difficult to track known variants and to detect new ones. Health systems are currently struggling with COVID-19 and caring for patients with influenza and respiratory virus, the RSV, health workers shortages and fatigue of health workers, vaccines, therapeutics, and diagnostics have been and remain critical in preventing severe disease, saving lives, and taking the pressure off of the healthcare system and healthcare workers generally. So we shouldn't really be letting up our guard. Yet the COVID-19 response remains hobbled in many countries that are unable to provide these tools for the population. And in our country, where the tools are there, we have decided that we're not going to be providing them now. The WHO Secretariat expressed concern about the continued virus evolution in the context of unchecked circulation of SARS-CoV-2 and the substantial decrease in member states' reporting of data related to COVID-19 morbidity, mortality, hospitalization, and sequencing. And they reiterated the importance of timely data sharing to guide the ongoing pandemic response. The committee stated that COVID remains a dangerous infectious disease with the capacity to cause substantial damage to health and healthcare systems. The pharmacy students could have made a powerful statement had they decided to attend the 1-hour ceremony masked. They could have demonstrated concern for those at the greatest risk who constitute the 170,000 deaths from COVID over the past 8 weeks. Instead, everyone chose to pretend that it's all over, and in the meantime, millions of Americans have lost their health care recently because we ended the emergency regulations. This is the bad news from last week, my personal experience of them. So I think I'll leave it there. I do want to get back to the history. I am gearing up for that. So we will get back and pick up where we left off with American history. But in the meantime, I would like to wish you a good week, and I'll see you next week with more bad news.